The following stages and procedures are to perform an inverted full-side hinge. Before proceeding, assess the structural integrity before removal of the B-pillar. Consider release of the casualty before the seatbelt is impacted. Stage 1 is to stabilise the vehicle. Stabilise as per SWP RCR 6 and/or 6.1. Stage 2 is to open the rear door lock. Open the rear door lock using the principles of SWP RCR 9. Stage 3 is to cut the base B-pillar. It is important at this stage that the vehicle is stabilised. Peel and peek behind the B-pillar to identify any hidden hazards, such as SRS firing cylinders, prior to making any cuts. The spreader may be required to create a wider opening between the base curve of a door and the B-pillar to allow the cutters better access to this area. Make a relief cut to the B-pillar parallel to the sill. Wherever possible, use the maximum length of the cutter blades to penetrate into the B-pillar. However, in some situations, a small cut may be all that is able to be achieved. Do not cut into the sill or seatbelt retractor mechanism. Stage 4 is to spread the B-pillar base. Place one spreader tip against the sill and the other tip just below the lower hinge on the door. Open the spreaders outwards, ensuring the tips maintain a grip on the sill and the door corner. While spreading the B-pillar, monitor the door window frame. Ensure it does not contact the ground, which could result in the vehicle being lifted off the stabilisation. Continue to spread until the B-pillar tears outwards and away from the sill. Stage 5 is to cut the B-pillar. If the casualty's head is by the B-pillar and low by the windowsill, cut the B-pillar and the window frame adjacent to the cantrail. Cut and remove the remainder of the window frame and the B-pillar as required. Stage 6 is to secure the side of the vehicle. Open the side of the vehicle, cut the retention strap and open fully. Lash the door or doors forward with a rope or strap to the front of the vehicle. Place sharps protection on all cut edges. Recheck all stabilisation. Hazards to be aware of are the operator being in the crush zone, uncontrolled release of the lock, the spreader contacts the seatbelt retractor or pretensioners, detached doors coming into contact with the feet and hydraulic hoses, contact with sharp edges, the door window frame contacting the ground, resulting in the vehicle being lifted off the stabilisation. Control measures to employ are: rescuers identify and avoid working in the hazard area. Use the spread strap to control release of the door lock. Ensure the tip placement is clear of the seatbelt retractor or pretensioner by peeling and peeking to expose hazards. The hydraulic hose and feet should be positioned clear of the drop zone. Ensure sharps protection is in place. Monitor and remove window frames as necessary.